I will admit that there are some imperfections in Obamacare. And there's no doubt about that. That said, I'm going to show you some information that relates to if there were some fixes, or if it were fully embraced, how much difference it would make in our health care. But it's certainly not Trump care. The Commonwealth Fund predicts if all 50 states embraced Obamacare, this is that part right here, and achieved results comparable to the highest performing states, health outcome improvement across the U.S. would look something like this. So this graphic, the point of this graphic is to show you that if all 50 states enrolled in Obamacare and the Affordable Care Act, and federal money flowed into each of those states, and the health insurance administrators bought into the game plan as well instead of dropping out of it, this is what our health care would look like if we didn't change anything. 20 million more adults and children would be insured. 14 million fewer adults would not have to skip health care because of cost. 26 million more adults would have a usual source of care. They'd have a medical home. 12 million more adults receiving recommended cancer screenings. And it goes on and on. Obviously, many, many improvements would be made if everybody were in that game. So what we need to do as we recraft our healthcare system is to make certain that everybody on some level compromise and come to the table and get into the game. One of the things that I don't understand is what happened to compromise. When I was in high school and in college and a young adult, we used to brag about how the United States was built on compromise. And that's just gone in the toilet. And nobody wants to move. And the Democrats are just as bad as the Republicans.